Good morning. Welcome you all to the February Public Safety News Briefing. The order for the day will be the Police Department, followed by the Winston-Salem Fire Department, Chief William Trey Mayo, and to close out, we'll have our Emergency Management Director, Mel Sadler. First of all, I want to take this opportunity to thank all the women and men of the Winston-Salem Police Department for all your hard work and dedication in your service to the citizens of Winston-Salem every day. We want to open our portion of the February Public Safety News Briefing by honoring our officers who died in the line of duty. Since we didn't have a news briefing for January, I'll start with the January officers and then end up with our February officers. The first one is Patrolman Donna W. Allred, end of watch, Monday, January 3rd, 1983. Incident details: he was struck by a vehicle, and the incident was Thursday, December the 30th, 1982. Officer Allred succumbed to the injuries he received 5 days earlier when he was struck by a truck while investigating an automobile accident. Next is Officer Robert Butrego, end of watch, Saturday, January the 15th, 1994. Cause of death, gunfire. Again, it was January the 15th, 1984. Officer Butrego was shot and killed while attempting to stop a robbery suspect at a grocery store he was shopping in. Officer Butrego has served the agency for 6 months at the time of his death. Patrolman Michael Ray Jennings, end of watch, Tuesday, January 29th, 1993. Cause of death, automobile accident. This was on Tuesday, January 29th, 1993. Officer Jennings was killed when his car slid into a tree and burst into flames as he was driving down a steep hill. His partner was also injured during this incident. February the 23rd, 2007, Sergeant Howard J. Pluff. Cause of death, gunfire. Sergeant Pluff was fatally shot outside a nightclub after he responded to a call for help from sheriff's deputies at approximately 2 a.m. 4 deputies were working in an off-duty capacity at a local nightclub when a fight broke out during a private party. During the fight, the crowd moved outside the bar and rounds were discharged, and Sergeant Pluff was shot during this incident. Sergeant Pluff was a 17-year veteran of the Winston-Salem Police Department. Police Officer Stephen Levi Amos II, end of watch, Tuesday, February 28th, 1995. Cause of death, gunfire. Officer Amos was shot and killed while he and his partner were responding to a shots fired call. Officer Amos and his partner positioned his vehicle into the street when a sniper discharged a weapon, and the round went through the vehicle and struck Officer Amos. Officer Amos was survived by his wife, brother, and parents. Let's all pause for a moment of silence as we honor these officers who lost their lives while serving the citizens of Winston-Salem. Thank you. The police department's order for today will be traffic safety, which will be presented by Sergeant Krausak. We will have business robberies presented by Lieutenant Steve Tolley. Police recruiting presented by Sergeant Tim James. And I will come up to provide some departmental updates and also some events that will be occurring. So first we have Sergeant Krausak.
Good morning, everyone. I'm Sergeant Kyle Krausak with the Winston-Salem Police Department Traffic Enforcement Unit. I'm the new sergeant over the Traffic Enforcement Unit, so I'm a new face to a lot of you in this room and in the public. If you have any questions in the future regarding traffic, please call the direct line for the Traffic Enforcement Unit, 773-7832. Again, 773-7832. As you all know, this time of month, January, February, March, is the winter months, and the traffic crashes increase, not only in our jurisdiction, but throughout the state of North Carolina. So today is a very appropriate day to speak about seatbelt safety. Wearing your seatbelt is probably the best defense against injury and possible death in the event of a crash. Seatbelt increases your chances of surviving a crash up to 60%. Despite this, far too many motorists still use excuses and various reasons for not wearing their seatbelts. And some of you may have heard these before, and let me know if you have. I'm not driving very far away, I'm just driving down the road. When the fact is, 3 out of 4 crashes occur within 25 miles of your home. I'm riding in the back seat, so I don't need to wear a seatbelt. When the fact is, you still have the chances of being thrown from that motor vehicle while you're riding in the back seat. I'm driving at night, so the law enforcement officers won't recognize me or won't be able to notice if I'm wearing a seatbelt. When the fact is, police are increasing their nighttime enforcement of seatbelt violations, and yes, they do see you. Or, I don't want to be trapped inside the vehicle wearing my seatbelt in the event the vehicle catches on fire, when in fact that less than 0.5% of all injury crashes involves fires. According to the North Carolina Traffic Safety Administration, each year approximately 33,000 people are killed as a result of motor vehicle crashes. In 2015, the North Carolina State Highway Patrol itself investigated 342 fatal collisions where seatbelts were not in use. 342 fatalities. In addition, in 2015, the Winston-Salem Police Department investigated 2 fatal collisions where seatbelts were not in use. These numbers are way too high, and it's our responsibility as individuals, not only in this room, but those out there in the public, to police ourselves to ensure safety while traveling on the roadways. With 45 to 60% effectiveness, seatbelts are the single most effective means of reducing the risk of death in a crash, and have saved nearly 300,000 lives since 1975 in the United States alone. Now, there's a couple general statutes I'd like to go over applying to the seatbelt use. The first one, North Carolina General Statute 20-135.2a, states the following, and this applies to wearing a seatbelt for those that are over the age of 16. Each occupant of a motor vehicle shall have their seatbelt properly fastened about his or her body at all times when the vehicle is in motion, on the street or on the highway. And of course, there's a penalty for that violation. The penalty could range anywhere from $175 to $180 for the front seat passengers, driver and front right passenger. And the penalties for the rear passengers are $10. Now, another North Carolina general statute that applies to children in the vehicle, states that every driver, each driver is responsible for those that are transporting one or more passengers less than 16 years old, shall have such passengers properly secured in a child restraint system or a seatbelt which meets federal standards. Additionally, a child less than 8 years old and less than 80 pounds in weight shall be properly secured in a weight-appropriate child passenger restraint system. And there's also penalties and fines for that as well for the driver who is responsible for those passengers. So here's a seatbelt tip for adults. Never wear your seatbelt behind your back or under your arm. Never wear your seatbelt behind your back or under your arm. Improper seatbelt use can actually contribute to serious internal injuries in a crash. And of course, the lap belt should always be snug and low across your hip. As a reminder, everyone 16 years old and older are required to wear a seatbelt, no matter what position you're seated in that vehicle. The driver, the front right passenger, or the passengers in the back. Here's a seatbelt tip for children. The type of seatbelt safety seat that your children needs depends really on the children's age and their weight. Age and the weight. Kids younger than 8 years old and weighing less than 80 pounds must ride in a car seat or a booster. So any kids younger than 8 years old and weighing less than 80 pounds must ride in a car seat or a booster. Depending on which comes first, kids can upgrade to a seatbelt once they turn 8 years old or top 80 pounds. 8 years old or top 80 pounds. Child car seats must be fastened in a rear seat if your child is under the age of 5 years old and weighs less than 40 pounds. So the key there is under 5 years old and weighs less than 40 pounds. And again, kids younger than 16 years old must wear a seatbelt regardless of where they sit in the vehicle. With that said, the Winston-Salem Police Department would like to remind motorists just to buckle up. Buckle up, because a click can save you money, and most importantly, it can save your life. Thank you. Does anybody have any questions? Next, I'd like to introduce to the podium from the Special Investigation Division, Lieutenant Tolley.
Good morning. My name is Stephen Tolley, and I have the privilege of serving as a lieutenant in the Criminal Investigations Division of the Police Department. Currently, I serve as the second-level supervisor for the burglary section, the robbery section, and the homicide section of that division. This morning, I want to take just a few minutes and speak with you about some recent trends we're seeing in our business robberies, and I also want to take a couple of minutes to speak directly to our business owners and operators and provide a few safety tips we can provide for those establishments that, first of all, we hope will deter some of these robberies, and secondly, will assist us in the investigation into the robberies that do occur at those businesses. Several months ago, as you will see in our graphic, we noted an upward trend in our business robberies. This is just a short snapshot that represents a 4-month trend, and it's a comparison for the previous 2 years up until this year. But as you will see, for that 4-month trend, we did have an uptick in our business robberies. The first thing I want to do is share a little bit of information with you about how we responded to that uptick in the business robberies. We established a robbery task force within the agency, and that task force worked closely with both our state prosecutor here in Forsyth County as well as authorities with the federal system, particularly alcohol, tobacco, and firearms, and the federal prosecutors. One of the things our goals were in that task force was to ensure that those agencies are sharing information and that our offenders who are using a weapon in commission of these crimes, that we are pursuing prosecution of those offenders at the appropriate level to ensure that they're incarcerated for lengthy periods of time and not out and capable of committing these crimes repeatedly. One of the second things we did that I can share with you is that we studied our data to try to determine the area geographically that these crimes were occurring at the highest rate, and also the time of day or night, time of the week, particular days of the week, and we have assigned plainclothes officers to work those areas. So we have undercover plainclothes officers focusing on our businesses and monitoring our businesses in the event that they are victims of robberies. As you can imagine, predominantly the type of business historically that is targeted for a business robbery is a convenience store or a gas station. Those businesses are generally targeted because traditionally they operate at least well into the night, and some of them are 24-hour businesses. Unfortunately, access to those businesses from major thoroughfares is usually high, in that an offender can target that business and have a ready route of escape from the business because of the way the business is strategically located. So most of the safety tips that I'm going to provide this morning are geared toward the operators or owners of those convenience stores, but would also be applicable to any business, a grocery store or anything else. The second thing I want to do is, as I speak to you, we're going to scroll through some still photographs, I should say, that are taken from the surveillance of those businesses. These are actually ongoing investigations, the majority of these, and these are still photographs that were taken from the surveillance systems at the stores when the robberies occurred. I wanted to bring these in to demonstrate to you as investigators what we are seeing and provide some of the tips that the business owner can take to hopefully, first of all, prevent this from happening, deter it from happening, but secondly, to assist us in investigating it if it does happen. The first thing I'm going to speak on this morning is the video camera surveillance system itself. And I want to make a couple of recommendations to business owners or operators. I'm not recommending a specific make or model of surveillance system, but I am strongly recommending to the business owners that they equip the business with the most recent high-resolution surveillance equipment that is available on the market. Resolution is the first thing that I would point out to you that assists us in our investigations. As you can see, for example, these pictures here, the quality of the image captured on those cameras is good. We can see marks and scars on the offender's face, and it's a clear picture of the offender. The likelihood of us clearing that particular case based on that surveillance footage is much greater than some of the other images that you'll see up here that the quality is not so good. So the first thing I encourage a business owner to consider when they're purchasing or upgrading their surveillance system is the resolution of the image itself. The second thing I would speak to you about is the ease of retrieval of those images. That becomes important if the business is the victim of a robbery or some other crime where the images captured on that system are of evidentiary value. What I want to encourage the business to invest in is a system that the images can be retrieved easily, and I encourage those business owners or operators to have someone either on duty or on call 24 hours a day that can access that system for law enforcement should that business be the victim of a robbery. The immediate accessing of those images as soon as an officer gets to that scene is crucial to our success rate in solving those crimes. It's crucial on two fronts. First of all, one of the first things the officer that responds to that business is going to want to do is try to get those images out to his or her fellow officers that are circulating the area of that business. The old saying, a picture is worth 1,000 words, is very applicable to this instance. So if we have a surveillance system that captures a high-resolution image, that the responding officer can get that image out to his or her fellow officers circulating the area that this robbery just occurred in, the likelihood of that officer coming across the offender while they're circulating that area increases drastically. And in a lot of instances, we can have an arrest in that particular case within minutes of the robbery being reported. The second thing that camera, high-resolution camera, assists us with in the very early stages of the investigation is focusing on where we're going to process that business forensically to try to identify this offender. In the images that I'm showing you this morning, you'll notice most of these offenders took tremendous steps to disguise their image, to disguise their appearance. They've covered their face, worn hoods, masks, heavy clothing, and as far as identifying them from the pictures, it's difficult. One thing you'll notice in the pictures is a lot of those offenders did not wear gloves. if we can zero in on areas that offender touched when he or she entered the store and focus on those areas specifically for processing for DNA and latent fingerprints, again, the likelihood of us successfully clearing that case and making an arrest goes up exponentially. The key to that is having access to that video system when we get to the store so that our forensics team can focus on those areas specifically right after this crime occurs. Another part of the surveillance system that I want to encourage the store owners to consider, in addition to the ease of the retrieval, is the length of time that the camera system stores the images that it captures, and also camera placement. I'm going to recommend to business owners, at a minimum, they have cameras focused on the customer area of the business. And speaking with a convenience store, that would be right in front of the cash register. At a minimum, have cameras focused on any exit point from the business. And I also want to encourage business owners to consider surveillance systems that have cameras that focus on the parking lot. Again, going back to the images that you see this morning, these offenders took tremendous effort, most of them, to cover their identity. They didn't arrive at the store like that. They didn't drive down the road and mask up like that. Most of these offenders stopped in the parking lot and took the time to cover themselves up before going into the store and committing the robbery. So if we have a business that has a high-resolution camera system that also focuses on the parking lot, there's a good likelihood a lot of these offenders are going to be captured on video before they mask up and before they conceal their identity. The other thing about these cameras is the posting of these cameras, highly visible, both in the parking lot and on the interior of the business. It serves as a deterrent to these offenders. These offenders, very often in the interviews we've conducted with them, have admitted they don't blindly go into a business and target for a robbery. They choose a business that they consider to be a soft target. So if an offender goes and cases a business ahead of time and knows that that business has cameras mounted both interior and exterior that are visible to the offender, very often that offender is not going to choose that target. He or she's going to go to a business that they consider to be a softer target. Finally, the recommendation I would make to the business owner is that the hard drive or storage location where those images are stored is at a secure location. A lot of our camera systems today have a cloud storage where the images aren't even stored on site. But if they are stored to a hard drive on site, the business owner needs to take some time and consider where that hard drive is kept so that the offender can't come in and during the robbery also take the hard drive storage device with them and take our best evidence with them. The second thing that I'm going to mention on target hardening of these businesses is that the business owner consider how they've got his or her store laid out, particularly the windows and entrances to the store. One of the things that I see very often that is problematic is that the business owner will have the windows to the store covered with advertisements for items sold in the store, and I understand that is a tremendous marketing aid for the business. It hinders the patrol officers who are out here working at night monitoring these businesses from being able to have a clear view inside that store as they drive by the business. So I encourage you to consider, as a business owner, taking the advertisements down and opening the view into the business up so that a patrol officer, while he or she's in the area, has a clear view into your store as she's in the area. Again, this will serve as a deterrent. And again, I can tell you from interviews that we've done with these offenders that have cooperated with us, that's another consideration that offender takes when choosing a business to target, is how well they will be concealed inside the business while he or she's committing the crime. Finally, I'm going to mention the safe in the businesses. And we recommend to you that as a practice, first of all, the business employees, anytime they take in large notes, $100 bills, $50 bills, that the business be equipped with a drop safe, that drop safe be bolted to the floor or otherwise affixed to the building so that the safe can't be removed. And that as a practice, the business employee, when they take the larger notes in, drop those inside the safe as opposed to simply storing them in the cash register, or as we often see, under the cash register drawers. I also recommend to business owners that as part of training their employees, particularly in the convenience stores, that the employee be trained on how to react if he or she is the victim of a robbery. The employee should be trained on how to address the robber, practices or policies of the business as far as compliance with the robbery, and also trained about making mental notes as to the appearance of the offender. The race, sex, stature, size of the offender, anything unique about the offender's appearance that might assist in identifying that offender after the crime has occurred. I wanted to be brief this morning, so those are just a couple of the points that I wanted to make, but I encourage business owners, if they have questions, to contact the Winston-Salem Police Department. There's certainly additional information that we can provide. And we certainly would be happy to sit down with those business owners and provide any other tips that we can to make that location a safer place for them. Are there any questions for me this morning? Okay, I certainly appreciate your time. And I'll invite the next speaker if I apologize. Sergeant Tim James.
Good morning. I'm Sergeant Tim James, currently assigned to our recruiting division. And I want to take advantage of this opportunity to talk a little bit about our recruiting process as well as some of our recruiting efforts. Many of you know that on November of last year, members of the Winston-Salem Police Department went to the City Council with concerns about attrition and salary. And this morning I'm happy to announce that the City County Council unanimously approved pay increase for public safety employees. With that increase in starting pay for new police officers, the starting pay is as follows: $35,549 with the high school diploma, $37,326 for individuals with associate's degrees, $39,192 with the bachelor's degree. And that plan's effective date was February the 1st of this year. We are confident that the new starting pay increase will aid us in attracting the best candidates to the Winston-Salem Police Department. The process to become a Winston-Salem police officer is extremely challenging, and there are a variety of steps an applicant must complete before he or she is invited to become Winston-Salem police recruit. We would like to take this opportunity to explain our recruiting process so that potential applicants are aware of what they must do to become members of this department. To begin the process, the applicant should go to the police department's website, www.wspd.org, and sign up for a test date. The recruiting unit offers testing dates at least once or twice a month. If an applicant is unable to attend one of the testing sessions, they can contact the recruiting unit to schedule a time to come in and test. We will try to work with that individual to accommodate them to meet their schedule. On the testing date, the applicant will begin by taking the test of adult basic education, also called the TABE test. This test scores an applicant's basic reading comprehension ability. Once a candidate successfully completes the TABE test, they complete an initial application, which is reviewed by the police department's recruiting staff. After review of the initial application by recruiting staff, secondary application packages will be electronically sent to the applicant. This application is very lengthy. This application is then submitted back to the police department and reviewed by recruiting staff to ensure that all state and departmental standards are met and that no disqualifying factors are noted. Some of the minimum qualifications: the applicant must be a U.S. citizen, at least 20 years old starting the academy, but they must reach their 21st birthday before the end of the academy, have a high school diploma or GED, be in good physical condition, be of good moral character with no felonies or serious misdemeanors, no DWI convictions within the past 5 years. They must be able to possess a valid North Carolina driver's license, and they must pass an extensive background investigation. Applicants selected to continue will undergo a preconditional offer of employment testing to assist the agency in determining the suitability of each applicant for the position of police officer. And these tests conducted are as follows: oral interview, which will be conducted by a 3-member panel of ranking officers within the department. Physical agility consists of a modified version of the police officer's physical ability test, also known as the POPAT. There is a link to this test on our website, and there is also a 1-mile run included in the physical agility portion of the testing. And there's also a suitability screener, which is a written exam. At this step, results of all testing and application materials are reviewed, and the applicant selected to continue will be placed into a background investigation. A thorough background investigation will be conducted, and the background investigation will assist in determining if the applicant is suitable for employment with this agency. Areas that will be examined include, but are not limited to, a person's employment history, also the criminal history and their involvements, driving history, civil history, credit checks, military service record, educational attainments, and etc. Essentially, every aspect of a person's life will be examined and evaluated during this process. Our goal is to employ the highest qualified individual to serve the citizens of Winston-Salem in the capacity of a police officer. Conditional offers of employment are extended to those who have successfully passed all preliminary testing and have been recommended through the background investigation. If recommended for hire, a conditional offer of employment will be extended. It is at that time that the applicant will be scheduled for a post-conditional offer of employment testing. And these tests are as follows: drug screening, medical examination, polygraph examination, and psychological interview. Once all steps in the application process are complete, all information on the applicant is reviewed by the Chief of Police. If the Chief approves an applicant for hire, a final offer of employment will be extended to those selected to attend the academy. Some of our recruiting efforts, the Winston-Salem Police Department is an equal opportunity employer, and we do our best to get this information out to the broadest audience possible. Recruiting efforts include, but are not limited to, some of our popular social media outlets, to include YouTube, Instagram, Facebook, LinkedIn, as well as more traditional means to include television, radio, billboards, and job fairs. We encourage anyone interested in joining the Winston-Salem Police Department to visit our website, www.wspd.org, or call the office and speak to someone in our recruiting division at 336-773-7925. Are there any questions? Thank you.
Thank you, Sergeant James. Just to close out our session, and I will be brief, but I do want to mention the Winston-Salem Police Foundation. It is a new foundation that we're very proud of. We understand that community partnerships are very critical to our mission and also improving our community relations. Again, the Winston-Salem Police Foundation is a not-for-profit independent organization that was founded this past May. It will designed, or it will provide critical resources that may go unfunded from traditional sources and city allocations. We're also using this to strengthen our police and community relationships by planning mentoring programs, community outreach, and eventually having a police athletic league. The board president is Scott Sewell, and for those listening who would like to learn more about the Winston-Salem Police Foundation, you can contact him at 744-0157. And just two additional programs that will be upcoming before our next public safety news briefing. We will have our third annual Public Safety Black History Month program. That's a program featuring the police and fire department. It will be February 21st, 2016 at 3 p.m. And it's open to the public, it's free, and it will be at Galilee Missionary Baptist Church, located at 4129 Northampton Drive. Also, on March the 5th at 7 p.m., in an effort to support Special Olympics, we will have a cops versus docs hockey game. That's where the police officers play against a lot of the medical professionals around the city. This game will be at the LJVM Annex, and all funds raised will go towards supporting Special Olympics. That's all that we have for the police department. If there are not any questions for anything that you've heard from the police presenters, we'll have Fire Chief William Chief Mayo come up. And I think there's one question in the back now. Not at this point. We're still waiting on information to be returned from the medical examiner's office. But as soon as that information comes in, we will be glad to provide the information to the public.
Chief, does that mean you're going to release the video when that information comes in?
That means, as we have mentioned in the past, John, once we have all the facts in and once all the information is in, after we meet with and consult with the district attorney's office, the video could be subject to be released. Next, we'll have Chief William Mayo to come up to present the fire department's information for this month.
Good morning. I'm Trey Mayo. I'm the Fire Chief for the City of Winston-Salem, and I would like to begin this morning by remembering Lieutenant Gilbert Kimball, who died February 11th, 1934. He was 33 years old. He was assigned to Engine 6. He was operating at a residential garage fire on Country Club Road and was caught under a roof collapse and died of his injuries a couple of days later. Also, as a more local and recent reminder of the dangers of providing fire and emergency services, I'd like to remember Joshua Woods. Firefighter Joshua Woods worked for the Siler City Fire Department in Chatham County. He died on January 12th of this year responding to a cardiac arrest, and he was 24 years old. And then James Varnell of the Bakertown Fire Department in Wilson County died on February 2nd. He suffered a medical emergency following a training exercise. He was 53 years old. So just again a reminder of the dangers of the business of providing for the public safety. And it's interesting that in the past 30 years, the number of fires in America is down about 53%. That's not an about number, that's an exact number. And in that same period of time, the number of firefighters who have died from traumatic injuries operating on the fire ground is up 67%. And that speaks to the fact of what is on fire today versus what was on fire 40 or 50 years ago, the proliferation of synthetics in the home. America's fire problem is in the home. 80% of all fires in this country are residential in nature, and 41% of those start on the stovetop. But in addition to what's on fire, the buildings we have built, the houses we have built in the past 25 or 30 years are tighter, and houses that will keep the heat out in the summer and the heat in the winter also do a great job of containing the heat from a fire. And the buildings are built in pursuit of economy and and with reducing the weight of materials, and all that's well and good until the house is on fire. And you know, a house built 40 years ago would burn for 25 or 30 minutes with fire in the attic before you saw a roof collapse. And today we're seeing roofs collapse in 6 or 8 minutes after the fire gets in the roof. So I just wanted to bring that to your attention as we talked about those fires and the fact that Lieutenant Kimball did die in a roof collapse some years ago. This morning I'm going to introduce Ms. Sabrina Stowe. She is our Fire and Life Safety Educator. She works out of the Fire and Life Safety Division of the Winston-Salem Fire Department. And she's going to talk about two things. One, Chief Roundtree stole a little bit of our thunder. She's going to mention also the Black History, the Public Safety Black History service that'll be later this month, and speak perhaps specifically about the honorees for the fire department this year. And she's also going to talk about a new initiative the fire service has started, and that is in instructing what we call compressions or hands-only CPR to the public in an effort to get more people trained in performing CPR immediately after identifying that somebody is in cardiac arrest. And the thing to note about this is it doesn't require any rescue breathing. If we can get members of the community to just do compressions, just chest compressions for 6 to 8 minutes, we'll have a fire unit on the scene to take over. But that first 6 to 8 minutes is very critical in the chain of survival for a victim of sudden cardiac arrest. So, Sabrina, if you'll come up.
Good morning. I'm Sabrina Stowe with our Fire and Life Safety Education Division. As Chief Mayo and Chief Roundtree both mentioned, do want to talk about the Public Safety Black History Month program that we do. It's a collaborative effort with the fire department and the police department where we come together once a year to recognize the historical accomplishments of our retirees. And this year, we're going to recognize two retired captains for the fire department. That will be Captain Aldine Cloud and also Captain Gary Brown. In addition to recognizing the two retirees, we're also going to be recognizing our battalion chief, Sharice Moore. She is the first African-American female to be promoted to this position. So we're also going to do a Trailblazer Award for her. Again, that program is going to be on Sunday, February 21st at 3 p.m. at the Galilee Missionary Baptist Church, and that's located at 4129 Northampton Drive. And again, that is going to be open to the public. The other thing I want to talk about are the efforts that the fire department will be conducting, as Chief Mayo mentioned, hands-only or compression-only CPR. This is something that we want to go ahead and push out to the public, and we're going to begin doing that very soon. We're going to be setting up some local areas that the public can sign up to and come and learn how to do the hands-only CPR. And in addition to that, you'll be able to contact us if you have a group that you would like to receive that training. The reason we're doing this, the American Heart Association sees benefit of doing compression-only CPR. There is a 2 to 3 times likelihood of survival for someone jumping in and doing the hands-only CPR. There is some hesitancy on some people's behalf to do the traditional CPR, including the mouth-to-mouth rescue breathing. But there is some benefit in the event of someone having a sudden collapse, an adult or teenager, where there is some benefit in doing just the hands-only CPR. Bystanders are going to be more likely to jump in and assist if they don't have to do the mouth-to-mouth portion of that. So there is great benefit in offering this program to the public. For information on setting up a session, this can be a civic group, this can be your Girl Scout, Boy Scouts, this can be your church group, whatever. Please contact us at 336-773-7965 or our general number 773-7900. Does anyone have any questions? Thank you.
we were pretty brief this morning. That concludes the fire department's part of the conference. Any questions for fire before we turn it over to Mel Sadler from Winston-Salem Forsyth Emergency Management?
Thank you, Chief Mayo. I'm Mel Sadler, Emergency Management Director for the City of Winston-Salem and Forsyth County. We just want to briefly talk about two quick items this morning. The first being, as you may recall, in December, we had a staff member here, one of our emergency management coordinators, who spoke rather extensively about the Emergency Planning and Community Right to Know Act and the fact that the filing period runs from January the 1st to March the 1st. We've been looking at some of the responses, and they've been fairly slow up to this point. And we want to bring that to the attention of our community partners who manufacture, who use, or who store hazardous materials. The time for filing of your inventory for the year 2015 is going to expire on March 1st, and we want to make sure everyone is aware of that who is involved in it. Behind me, I think we see the website that we talked about in December. That's a pretty complex website. If you want to get to it a little quicker, you might want to go to the City of Winston-Salem's website at the Emergency Management site. And we do have this information on our website, which is also the link that you see here before you is on our website. If there are people who have questions or concerns or some other situations that they want to bring to our attention, feel free to contact our staff member who was here in December, Robert Reese. You see behind me his website, his email address and his telephone number. So give him a call if you have a problem, but we want to remind everybody who is involved that the deadline for filing will be March 1st of this year, as it is always. Secondly, our community is blessed with a number of good partnerships, and our office is blessed with a good number of good partnerships. One of those strong partners that we have is the Forsyth County Public Health Department. You may or may not be aware that this is the 100th or the centennial anniversary year for the Forsyth County Health Department. They've been around for 100 years, and we're certainly proud to work with them every day because they do an excellent job in a variety of situations and events. To discuss that centennial a little more thoroughly, we have with us today, we're pleased to have with us, Mr. Marlon Hunter. He is the director of the Forsyth County Public Health Department.
Morning, everyone. I'm Marlon Hunter, and I am the director of the Forsyth County Department of Public Health. And this year we are celebrating a significant milestone. You know, public health is a wonderful profession. It is one that requires all of us in the profession to have passion for the work, and it is also one that's very rewarding. You know, in Forsyth County, has a very strong public health department, and I am proud to serve at this time as the county health department director during this time, after having spent 21 years of my career in public health, serving across the Southeast. Public health, whether you really realize it or not, has an impact on all of our lives. Whether you ever set foot in the health department for a visit, we impact you. So if you drink water or you eat food, if you have children in daycare centers, if you have family members coming in town, staying in hotels, if you have parents or family members in our senior centers, our staff members are out visiting all of those places every day. We have nurses in all of our schools, and so from a public health perspective and in terms of making sure our community members are safe, we touch everyone in all aspects of life course. So I am very proud of this department and the work that we are doing in this community. In the past, or focusing on the past, public health has made many great achievements all across America. And one of the most significant achievements are vaccines and vaccine-preventable diseases. Now, some of these topics, for some people, may be controversial because, as you know, some individuals don't believe in vaccines and vaccine-preventable diseases. But vaccines has increased our life expectancy since 1900. Since the year of 1900, public health can receive credit for 25 of those years of life expectancy over the past 30 years. So let me just say that again. Since 1900, life expectancy has increased by 30 years, and 25 of those years are attributable to the advances in public health. So that's vaccines and vaccine-preventable diseases. Public health has been instrumental in getting laws on the book for motor vehicle safety, wearing seatbelts, wearing helmets, workplace safety in the occupational safety and health realm, the control of infectious diseases that spread throughout our communities, safer and healthier foods, healthier mothers and babies, family planning, and so many, many, many more advances. There's been a 100-year shift in public health and health outcomes all across the U.S. and as well as in Forsyth County. 100 years ago, the leading causes of death was pneumonia and tuberculosis, diarrhea, and today the leading causes of death is cancer, heart disease, and lung disease, and more chronic disease-related issues. The leading causes of death in the United States has shifted from infectious diseases to chronic diseases. Chronic diseases are the most common today, they're the most expensive, and they are the most preventable of all health problems. So you will probably hear conversations, if you haven't already, in our medical community and our public health community about healthy payer mix when individuals come to the doctor and they need to pay, or hospitals need to bill for services. The topic of fee for service, will come up, and because as a result of the Affordable Care Act, in our country right now, we are moving largely from a fee-for-service kind of a payer system to a more of a value-based system, and a value-based system meaning one that is focused more on prevention and education. So that is right in line with public health and what we've always done for many, many, many years. And I think this is a great time as well in the world of public health because we have an opportunity to focus on prevention. On our next slide, I want to talk about our county health rankings. Our county, you can find this information at countyhealthrankings.org. This is a very comprehensive tool developed by the Robert Wood Johnson Foundation in partnership with the University of Wisconsin. This tool has been in effect all across the U.S. since 2010. And what this tool does is rank our health outcomes across a variety of topics, to include public safety as well. When you take a look at this tool and you view this data in North Carolina, keep in mind that this tool ranks health outcomes based on the number of counties that exist in each state. So in North Carolina, we have 100 counties. So number one is the best, and 100 is ranked as the worst. So when you take a look at health outcomes in Forsyth County is ranked number 29. When I pull this data, I compare us not across all counties around the state, but I compare us with the 5 large metropolitan counties in North Carolina. So you can see that Wake County is ranked number 2, Mecklenburg County is ranked number 5, Guilford County number 10, and Durham County number 11. This tool is very comprehensive, and I would encourage all of you to go out, take a look at this tool, and see how it works. I think you'll enjoy reviewing it. What you will see, which I think is important and what I want to really highlight about this tool and about our health outcomes in Forsyth County, is that there's a greater statistical correlation to poor health outcomes and the social determinants of health than access to clinical care. So what does that mean? We need to really focus on finding ways to improve health outcomes by marrying both clinical, medical, and non-medical models in our community in ways that we can use to improve health outcomes. What are we doing in Forsyth County? Once I took this post in 2011, I had an opportunity to take a look at one very basic thing, is the mission of the health department. I believe that partnerships are key, so I wanted to have partnerships added to that mission, because we don't have enough staff and we don't have enough resources at the local health department to really work with our community in ways that we should to help us improve our health outcomes. So we really have to rely on our partners to get this work done. So that means our media partners, fire department, police department, our universities, our churches, our schools, individuals, community-based organizations, everyone who has a focus on health outcomes, we want to partner with. Because public health is not just what the health department does, but it is what we all do individually and collectively as a community to improve our health outcomes. So I want to invite all of you individually to come and start working out with me at 5 a.m. each morning before going to work to individually improve our health outcomes. I want to highlight a couple of community-based organizations that's doing great work that's worth noting. Our food bank just received a very large Feed America grant, and I want to commend them on that work. They are going to focus on health, food, housing, and employment. And when you take a look at those indicators, those are some of the social determinants of health I just mentioned a few moments ago that are very instrumental in improving our health outcomes. United Way is doing place-based work. They are focusing on health outcomes in our community in those zip codes and communities where we have identified significant health-related issues. So we have been able to go in by zip code and narrow down where we see the biggest issues in our community. And so we have a very deliberate place-based focused with our partners in those areas to help improve those health outcomes. So I want to encourage all of you, when and where possible, whether it's working with United Way or the food bank, or working with us at the health department when we conduct our community health assessments, to try to get engaged with us so that we can all continue to work together to improve our health. Health is wealth. Our work really is working. We are seeing improvements in the area of teenage pregnancies. That number is down as of 2013. We saw an 18.7% decrease. We have seen a major decrease in smoking in high school students as well as middle school students as well. We're very proud of that because we don't want our children smoking and getting addicted to nicotine and tobacco-related products. And then we've also seen a significant increase in our infant mortality rate. This past year, we've seen we have the most significant decrease in the history of Forsyth County since the North Carolina Center for Health Statistics started collecting data in the mid-90s. So right now we are at 6.4 per 1,000. So that is very significant, and we're very proud of those numbers at the health department and for our community and for all of our partners. In 1916, those numbers were 206.4 per 1,000. So 100 years later, we are at 6.4 per 1,000. So that's a significant improvement, and we need to continue to work towards making those improvements. In the future, we are seeing at the health department many emerging and re-emerging diseases and threats all around the United States, not just in Forsyth County, but all around the U.S. We thought we really had a handle on botulism. Of course, you've seen obesity rates increase. Autism, you've seen we have seen over the past year in particular, sexually transmitted infection rates increase in the area of chlamydia, gonorrhea, and syphilis in this community. We've seen the plague, the bubonic plague, when that's significant to see that come back again. Skin cancer. We have Zika virus that's on the scene right now. We've heard of West Nile virus, H1N1. 2 years ago, we saw a significant spike in whooping cough, pertussis, and dengue fever, which is also a mosquito-borne illness. So we are seeing some of these diseases come back that we have worked really hard to get a handle on by using vaccines in our country. They are coming back with a vengeance and vaccine resistant. And so please keep some of those in mind as we work to share information in our communities. One particular program I want to take some time to highlight is in the area of sexually transmitted infection, to just highlight more about what we are doing in our community as we see emerging and re-emerging diseases and threats come up. We have a very robust and strong program in the area of sexually transmitted infection. We are out in the community. We are partnering with all of our universities that you see. We have a strong partnership with our sheriff's department, so when individuals come to jail, we test every inmate in the jail for infections as well. We are working with Wake Forest, the Wake Forest School of Medicine, and the hospital to do more research, to find more cutting edge and innovative ways to accurately and more rapidly test for sexually transmitted infection. So we're really happy about this work, and what it does for all of us is improve our health outcomes in the community. We are also partnered on a very national level. I have a responsibility not just as your local public health director, but I work on a state level and a national level as well to gather as much information as I can, of course, to bring back here to Forsyth County. And so I do that in partnership with the National Association of City and County Health Officials, the Centers for Disease Control, and as well as the American Public Health Association, all around the country. The National Association of City and County Health Officials is an organization that represents 3,000 health departments around the country. So when we see issues or we have things pop up in our communities, like our Flint, Michigan related topic that we've all seen in the news as well, we all have an opportunity as local health directors to share information and data with each other so that we can help our communities. The final slide I have is our open house. Our health department is going to have a community celebration in the lobby of the health department. We want to invite all of you and our community members to the health department. If you've never visited please do take it as an opportunity to see all of the rich history that we have from a public health perspective here in Forsyth County, and on April the 6th from 5 to 6:30 p.m. Thank you very much. Are there any questions? And the question is, are we monitoring Zika virus in Forsyth County? And the answer is yes. One thing I think Forsyth County should be proud of is the fact that at the health department, we have a very well-funded vector control program where our staff are out in the community spraying for mosquitoes every year. We adulticide and larvicide, so that those are two programs designed to kill adult mosquitoes and the baby mosquitoes that hasn't hatched yet. We really focus on, I would encourage everybody in the community to focus on breeding sites. We know that mosquitoes tend to breed in warmer weather and warmer climates. So I think now is the time, as we move towards the end of winter, to get rid of those breeding sites. So old tires, bird baths, containers in the front yard, bottle caps, you know, as insignificant as we think those things may be, mosquitoes breed by the thousands in bottle caps. And so we want to try to eliminate those breeding sites. And as the springtime comes around and we are doing spring cleaning, wear long sleeve clothes, use DEET. And I would just say go to the Centers for Disease Control website. We have the most up-to-date current information and data about Zika virus and how it's evolving right now. We've all heard tons of information about how it is, has the potential to have an impact on pregnant mothers, microcephaly in particular, babies born with small heads and small brains. And so I want to encourage everyone to just know that it's evolving. We don't have all of the answers. It's not treatable. We don't have a vaccine. And so just keep an eye out on the information as we present it and as it is coming forth. It is a moving target, and we're trying to keep everybody informed as quickly as we can. Yes, the question is, you know, for individuals who have traveled out of the country into the most highly infected areas, when they come back to the United States, do we want individuals to report back to the health department? And if you can, that would be great. So if you know that you've been in an area where you've had a potential to get exposed, it would be wise, especially if you come back and you find yourself or your family members presenting with symptoms. That way we can get ahead of the situation as quickly as we possibly can. And so absolutely, the faster you can share information with us at the health department, the more quickly we can really help you with what information and what treatment, any possible treatment or the ability, or treating any symptoms you might have related to any possible contact with mosquitoes. Any more questions? Okay.
Is that something that's new, though?
The jail, her question is, you know, have we conducted testing in our jails for an extensive period of time? And the answer is yes. We have worked with the Sheriff Department for a number of years to test our inmates in Forsyth County. So remember, all of you, public health is not just what the health department does, it's what we all do individually and collectively as a community We tend not to really take some of the issues that we see seriously until they arrive at our doorstep in America. We're a very advanced country, and we have means and the ability to really control many of the things that we see happening around the country. But just be mindful that we're not exempt from any of these issues arriving here. And if you have any questions or concerns, to just consider giving us a call at the Health Department. Thank you.
Thank you, Mr. Hunter. Are there any other questions for emergency management or for public health? Seeing none, I will let you know that our next public safety media briefing will be March the 9th. And we thank you for coming and joining us today. Thank you very much.